Hello friends, today we are going to talk about sleeplessness. Sleeplessness basically है क्या क्यों होती है और उसके क्या reasons हैं. So we are going to talk about some of those points. Sleeplessness में basically patient is not able to have a sound sleep due to various reasons. These reasons can vary from medical conditions to various psychological and mental issues, or it can result from just from normal physical ailments, and in some cases even in children and infants these conditions can arise, which can be due to many reasons. So today we will be discussing about some of the homeopathic medicines that can be prescribed according to the causes that cause this sleeplessness. So let's begin. So first of all, the most common cause, sometimes the patient comes and says ki they don't know why they are having this sleeplessness, like they don't have a valid reason for this. In those cases, sulfur is a very good remedy that can be prescribed. Then sometimes the patient says that sleeplessness occurs right after midnight, यानी कि बहुत लेट पेशेंट सोता है और मॉर्निंग में लेट उठता है, या फिर कई बारी ड्यू टू दैट अगर एक बारी वो उठ जाता है आफ्टर मिडनाइट और आफ्टर लेट इन द नाइट, he is not able to sleep properly. So in those cases, Nux vomica is a good medicine. Then there are some persons in some जहाँ पे they are not able to have a normal sleep for several nights at a time, and they also wake from slightest noise or disturbance, or they have a very light sleep. In those cases, phosphorus is a good medicine. Then also there are some patients जहाँ पे पेशेंट को ड्यू टू मेंटल वरी करके या फिर उनकी नींद जो है बहुत लाइट रहती है, डिस्टर्ब हो जाती है ईज़िली, और इवन कई बारी उनको स्लीपीनेस रहती है पर ड्यू टू द डिस्टर्बेंस इन देयर सराउंडिंग्स दे आर नॉट एबल टू स्लीप प्रॉपर्ली. Also sometimes because of excessive physical exertion during the day, or if they are doing hard physical work during the day and they become too much fatigued at night, they are not able to sleep properly. So in those cases also Talus or coffea is a very good medicine. देन देर आर सम पर्सनस जहाँ पे कि पेशेंट को बहुत ज़्यादा नींद आती है ड्यू टू डिस्टर्बेंस के करके, या ड्यू टू पेशेंट इज़ नॉट एबल टू स्लीप प्रॉपरली ड्यू टू सम issues with the family, or due to some stress in the family, or stress of cares and worries about the family, or if they have some person who is sick in the family and they're taking care of that person for a long time, and due to this stress they are not able to sleep properly. In those cases also Cocculus or Ambragracia, Curtilaria are some good medicines that can be given. Then there are some patients जिनके अंदर की ड्यू टू ग्रीफ और वरी के कारण, या फिर कई बारी पेशेंट की फैमिली में कोई ट्रेजेडी हो जाता है और उसके कारण बहुत ज़्यादा mental stress रहने लगता है पेशेंट को. In those cases Natramur is a good medicine that can be prescribed, or even Ignitia can be prescribed in such cases. Sometimes what happens is the patient is able to sleep properly, but when he wakes up in the morning he is not able to get a fresh sound sleep during the night, एंड मॉर्निंग में वो फ्रेश नहीं उठता, यानी कि वो मॉर्निंग में एक्टिव नहीं होता, डलनेस रहती है उसको, और वो स्लीपलेसनेस उसको लगता है कि उसे नींद आई है, बट इन रियलिटी इज़ नॉट एबल टू हैव अ साउंड स्लीप. In such cases also there are medicines such as Simisifuga, Cinnaberes, or even Merxol and other medicines that can be given to the patient. अब हम कुछ बात करते हैं कि कुछ केसेस में पेशेंट को, इन चिल्ड्रन स्पेशली, इफ़ वी टॉक अबाउट चिल्ड्रन में कई बारी पेशेंट जो बच्चे हैं वो मॉर्निंग के टाइम दे आर स्लीपी, एंड ड्यूरिंग द नाइट टाइम दे आर बिकमिंग मोर एक्टिव. So when they become more active during the night, definitely they are not able to sleep and they have sleeplessness problem later on. So in such cases Cypripedium is a good medicine that can be given to the patient or the child. Then there are also some patients or children where they are going to hostels or outside the home for work or studies. and in those cases they miss their home and become homesick, and then they have this problem. In such cases, capsicum is a very good medicine that can be given to the person. Now we will talk about some issues that can occur, causes of sleeplessness, and the medicines that can be prescribed accordingly, such as if they have having acidity and flatulence and other issues with the stomach disorders. In such cases, if they are not able to sleep properly at night, then medicines such as moistures, Nux vomica, or even Atramphos and other some medicines can be prescribed to tackle the cause of the sleeplessness. अब कई पेशेंट्स में होता है कि आफ्टर दे गो फॉर अ सर्जरी लाइक एब्डोमिनल सर्जरी एंड एनी अदर सर्जरी, and after that they suffer from sleeplessness. In that cases also, if they are having pain in the area of the surgery, or if they have some issues in the body due to that, after the surgery they are not able to sleep, then medicines such as Sticta pulmonaria or Staphylococcus or even arnica and some other medicines can be prescribed depending upon what issues of sleeplessness they are having and what symptoms they are getting due to that. Now sometimes in older patients it has been seen that रात के time usually they have to wake up frequently to go to the washroom. उनको बार बार यूरिनेशन होता है रात के टाइम, और इस करके पेशेंट को जो यूरिनेशन होता है दे आर नॉट एबल टू हैव अ साउंड स्लीप. In such cases, puja is a very good medicine that can solve their problem. Then in cases there is some issues with skin problems such as itching होना, या किसी करके उनको बहुत ज़्यादा skin का issue है and they are having some itching in their body, and due to this problem they are not able to sleep, so they become very restless, anxious, even there is some prostration or weakness in the later stages. So in such cases, medicines such as lactifluoratum or sorinum or sulfur can be prescribed depending on the individual symptoms of the person. Next, कई बारी क्या होता है कि पेशेंट हैज़ वर्टिगो और चक्कर आने के कारण उनको नींद नहीं आ पाती, या वो किसी पर्टिकुलर साइड पे लेटते हैं रात के टाइम, अगर लाइक राइट और लेफ़्ट साइड, और दे आर नॉट एबल टू स्लीप ड्यू टू द वर्टिगो. In those cases, medicines such as Merxol, Conium, depending on what side they are having the problem, or Caladium or some other medicines can be prescribed to the patient. Now, कई बारी in some medical issues such as like body pains होते हैं patient को in rheumatic cases, जहाँ पे कि पेशेंट को rheumatism के कारण रात को उस पूरी बॉडी में सीवियर पेन रहता है, and due to this they are not able to sleep. So in such cases, medicines such as Daphnia indica, such as other medicines such as Staphylococcus or Merck can be given to lower their pains, and then they are able to have a sound sleep. Also in some persons there may be back pain due to at night, and when they wake up also in the morning they have issues because they are not able to get proper sleep at night, and in those cases medicines like Merck, Laxative, nuts can be given to the patient. Now complaints, some patients में क्या होता है कि after they are having fever or cough, they have been suffering from this for a few days before, and now they are okay with that, but the cough is lingering on for some time, and they are not able to get that proper sleep due to that cough. In such cases, medicines such as Hyoscyamus, Sambucus or other medicines can be given. Next आते हैं हम कुछ मेंटल इश्यूज़ में जो पेशेंट को स्लीपलेसनेस के कारण हो जाती हैं, जैसे कि एंग्जाइटी हो गया पेशेंट को, अगर किसी को डिस्निया होने लग जाता है, पाल्पिटेशंस होने लग जाते हैं, या कई पेशेंट्स में ड्यू स्पेशली इन चिल्ड्रन इफ दे हैव नाइटमेयर्स ड्यूरिंग द नाइट एंड दे आर नॉट एबल टू स्लीप प्रॉपर्ली ड्यू टू दैट. In those cases also there may be medicines that can be given depending on what their exact symptoms are. Next, we come to cases where sometimes the patient is having a sound sleep during the night, but when they wake up in the morning, they have some other complaints. In these cases also we have good homeopathic medicines which can be prescribed to the patient. Now, for example, if the patient wakes up, like any physical complaint the patient is having, and during the night he is able to sleep, but जैसे ही वो सुबह उठता है पेशेंट, तो वो आके बोलेगा कि डॉक्टर साहब हमारी तो पूरी बॉडी की पेन्स ही शुरू हो जाती हैं मॉर्निंग में उठते साथ ही, या हमारे को उठते साथ ही सारी हमारी जो प्रॉब्लम्स होती हैं वो स्टार्ट हो जाती हैं. So in these cases, belladonna, laxatives, nux vomica and some other medicines can be given to the patient according to their individual symptoms. Also, sometimes there is soreness of the limbs in the morning when the patient wakes up, or there is stiffness of the limbs when the patient wakes up in the morning. खास करके in rheumatic and sciatica patients में ये देखा जाता है. तो in cases के अंदर also medicines can be given. Now, sometimes patients have digestive issues when they wake up in the morning, or they have bitter or putrid taste in the mouth, or they may be feeling headache or cough in the morning when they wake up. So in those cases also, depending upon what they are having after they wake up in the morning, symptoms can be taken and then the medicine be prescribed accordingly. Now, these were some of the general information and some of the homeopathic medicines that can be given to the patient according to their symptoms. Now, let's talk about general management about sleeplessness. What we can do as an individual to improve our sleep cycle. So, the first thing that is important is that the patient should start having a proper routine of 8 hours of sleep every day. Those persons who are not able to take at least 8 hours of sleep every day, they tend to develop later on in the stages accumulative effects of lack of sleep, और उसके कारण पेशेंट को ये सब इश्यूज हो सकते हैं. ऑल्सो क्योंकि आपकी बॉडी का एक कार्डिनल रिदम होता है, एक साइकिल होता है स्लीप का. सो उस साइकिल को मेंटेन करने के लिए इट इज़ इम्पॉर्टेंट कि आप मॉर्निंग और इवनिंग में जब भी सोएं, you should get a routine time fixed for that. Like if you're sleeping at 10 in the night, then make it a habit to sleep every day at the same time. So that way your body gets accustomed to the sleep cycle and you start getting a good sleep gradually. Also, it is important that you eat light before going to bed at night, especially उन patients में जिनके अंदर की digestive issues, acidity, heartburns, headaches या अदर इश्यूज़ रहते हैं और जिनका वाटर इनटेक कम रहता है, उन केसेस के अंदर इट इज़ इम्पॉर्टेंट कि पेशेंट अच्छे से अपनी प्रॉपर नींद ले, अच्छे से सोए और रात को खाना अपना एटलीस्ट 2 घंटे पहले सोने से पहले ले लें. और दैट शुड बी ऑल्सो वेरी लाइट फूड. They should avoid any spicy or fatty or fried food, especially at night, and they should take it 2 hours before going to sleep. नेक्स्ट जो प्रॉब्लम आता है इश्यूज़ इसके अंदर कि पेशेंट को क्या दिक्कत है इसके अलावा स्लीपलेसनेस से, उसके अकॉर्डिंग उसको हम सजेस्ट कर सकते हैं कि व्हाट दे कैन डू. लाइक सम पीपल लाइक टू गो टू बेड, बिफोर गोइंग टू बेड दे लाइक टू रीड, और some they like to watch TV. So that is a normal body ways of adjusting to your body's needs and then making a habit or a ritual that you follow every day at the same time. So your body gets accustomed that this is your sleep time now, and then the body starts shutting down and you start feeling sleepy gradually. So these were some of the tips and suggestions that we usually give to patients who suffer from sleeplessness. अब हम बात करते हैं इसके अलावा स्लीपलेसनेस के, कि पेशेंट को अगर स्लीपलेसनेस के कारण कोई और इश्यूज आते हैं एंड दे आर नॉट स्टिल एबल टू स्लीप, then they need to find out like is there any psychological, mental or physiological issues with the patient or his surroundings or environments. Also because sometimes there are patients who have family issues, they have issues with mental issues in the family, or they may be depressed. Some patients also have sleeplessness due to work stress or due to too much hectic work. So depending on what their mental condition is at the time, sometimes we can tackle those problems and cure the sleeplessness. So these were some of the normal suggestions about sleeplessness. एक चीज़ मैं और ऐड करना चाहूँगी कि पेशेंट कई बार ये जो स्लीपलेस होते हैं उनके अंदर अगर ये कंडीशन काफ़ी समय से चल रही है, so gradually their hippocampus, that is a small area in your brain which actually gets to becomes depressed, and that starts affecting your memory. So it is important that especially those people who are very forgetful, or some people who are not getting proper sleep, they become very forgetful, or sometime in their normal routines also they tend to forget things. So these are some of the indications which you can find in people, and we know that these people are suffering from lack of sleep. So in these cases, hippocampus of the brain starts getting decreased in its activity, and the memory area of that brain, you are not able to retain a good memory, and that's why you are having those issues in the morning about forgetting things, or short memory, or you are not able to recall things properly, or what happened a day before. So these are some of the psychological and mental problems which occur, or which may happen if this is not cured. Also, in the long term, in very chronic cases, sometimes the patient's organs start shutting down because the patient is in severe lack of sleep. They are exhausted in both mind and body, and when that happens, their irritability may increase, their productivity may decrease. At work, they may become more lethargic and depressed, they may develop other physical ailments. So all these conditions gradually add up to getting sicker and sicker day by day. So it's very important that every person takes a good night's sleep, at least of 8 hours of day, and if by some reason they are not able to do that, they try to compensate that in the coming week, or day before or after that. So I hope you had some good information and enjoyed watching this video. So all of you have a great day, and God bless.